everybody. I'm Paula Ebben. We continue our three-part family focus series on maternal health from conception to 1 year out. A recent CDC report found that 60% of maternal deaths are preventable. And we've talked about what to do before you conceive. Now we'll focus on the 9 months of pregnancy. And Dr. Mallika Marshall joins us once again, of course. And doctor, we know that a third of maternal deaths occur during a pregnancy. So what types of serious complications can happen during pregnancy?
Okay, so most women experience annoying symptoms.
Right.
And sometimes conditions like anemia and dehydration, and if those things aren't addressed, they could turn into something more serious. But today we're talking about things like high blood pressure in pregnancy, preeclampsia, which usually involves high blood pressure as well as some issues with the kidneys and the liver, gestational diabetes, having elevated blood sugar in pregnancy, infections, blood clots, and preterm labor.
Right. So as you say, there are annoying symptoms of pregnancy. I think many of us got morning sickness or other issues like that cropped up.
Yes.
But what are the warning signs that something really serious is going on?
And again, it can be confusing because some of these signs and symptoms you can have during a normal pregnancy, but if you develop any of these things, you really should check in with your prenatal clinician, whether it's an obstetrician or a nurse midwife, for example. So if you have an infection, that could be a sign that you have some sort of serious infection. If you have bleeding or spotting, again, you can get that during a normal pregnancy, but it might suggest that you're having a miscarriage or going into preterm labor. If you have pelvic pain, again, can be normal to have some cramping, but could it be an infection? Are you having contractions? Pain with urination suggests you might be having a UTI. If the baby isn't moving as much as they did before, that's a reason to give them a call. Pain or swelling in your calf or your leg could suggest a blood clot, worsening swelling, preeclampsia, shortness of breath could suggest a blood clot, pneumonia, lung disease, and then headaches could suggest that you have preeclampsia.
Yeah, so of course bleeding is always number one, right? And it shows you have to have this continuing, ongoing conversation with your OB/GYN throughout the entire pregnancy.
And they usually have someone on call 24 hours a day for you to at least chat on the phone about it.
That's right. So in our next Family Focus, we'll take a closer look at the danger for moms in the first few months after giving birth. Our thanks to Dr. Mallika Marshall. We'll see you next time.